Hmm. Hello, hello, and good day, everyone. I am Onyi. I also go by ONYI LOVE, and I am so happy to be here for discussion number 4 of Heal the Healers. And Heal the Healers is an initiative that I have created underneath my brand, and I imagine other individuals are focused on this type of work to provide care, services, support, a level of understanding for healers. And for me, healers is an overarching category that I'm using to include medical practitioners, birth workers, death workers, first responders, educators, and so many other individuals that in some way, shape, or form are serving the collective, serving the collectives through all the different experiences that we have as human beings on this earth together, and really supporting them in attending to their care, attending to their wholeness, their healing, so that they can show up for us more fully and recognizing that our healing is intertwined. So, thank you again for joining me for this discussion today. And the discussions we've been having have been so wonderful, and I look forward to continuing those discussions with different individuals across, again, that spectrum of the healers. So today I'm so excited to have two guests that will be joining me today. And I'm going to bring in the first guest, and the second guest I will be bringing in during a different time of the call. We had some scheduling things that we had to navigate, but we're going to make it work and have a great conversation discussing what is relevant to people specifically in the medical field, in the ways that they are, the medical field and the psychiatric field. So I'm going to bring in my first guest, and then I will introduce her and then give her the opportunity to introduce herself. Hi.
Hi, Felicia. How are you?
I'm doing well. I'm doing well. Um, I'm going to pull up your information.
Okay.
So, again, welcome everyone that is joining and watching with us live. I am Onyi, and I also go by ONYI LOVE. So, I am bringing on my guest, Sarah Emmons. Thank you, Sarah, for joining us. And I'm going to read a bit about your bio. I'm going to read your bio and then give you the opportunity to describe yourself from your own words, in different words, if you like to do
Thank
that.
you.
So, Sarah is a psychiatric mental health nurse practitioner. So, she is an advanced practice registered nurse and is certified as I mentioned, a psychiatric mental health nurse practitioner. She has a master's of science in nursing and a bachelor's degree in global studies. Sarah has worked in behavioral health for approximately 6 years and is currently employed on a consult liaison service working within hospitals. So thank you so much, Sarah, for being here with me. And Sarah and we've been friends for how many years now?
Oh, I would say 13, 14.
Oh my God.
Yeah, around that long.
Like yesterday.
Yes, it doesn't seem like that. I had to figure out my daughter's age to figure out how long.
Yeah, no, that's awesome. And I'm so grateful to have Sarah in my life. Since the moment we met each other, she's just been a joy and a blessing to get to know, and to know and interact with her family, and the connections that I have with the family are really beautiful. And so I'm just really grateful for you, period, as the person you are. And then I'm also grateful for the work that you do and for the conversation that we get to have to really give people some insight from your perspective about this work and how to support you and your colleagues. So feel free to share about yourself in other ways that are not limited to just your vocation.
Sure. And thank you for having me. I appreciate it. And you do mean a lot to me, and we have had a good friendship. So I appreciate you very much.
Thank you.
Um, a little bit more about myself. I have a husband. I have a 14-year-old daughter, recently 14 in March, and a 6-year-old son. I love traveling. I like art, and I really like working with people in general.
Yeah. And I remember that about you in terms of liking to work with people. Did I know you when you had started your studies?
You knew me after global studies and then prior to nursing.
Yeah. Okay.
Yes,
Yeah.
like
And
right in between the two.
yeah. And I remember as you were talking about, the things that you wanted to do and the
Mhm.
specific area of healthcare that you wanted to get into because you saw a need for, I think it was like a certain level of compassion, a
Yes,
certain level of care, a certain level of just the way to see the patients. I feel like remind me if I'm wrong. I feel like that was something that was like a big impetus for you for actually getting into this specific area of medicine of psychiatric health. And yeah, please talk more about that in terms of, your reasons for getting into this business.
sure. So I started on a medical surgical floor, which is basically just attend. I did a whole lot of IVs, medication administration, wound dressings, um, just a lot of solely medical aspects of that field. Um, but the thing I liked the most was actually talking to the patients and kind of tending to their mental health. Because I felt like once you got that, you're better able to care for their physical needs. So
Yeah.
that's what brought me into it. And then I went to a partial program, is what they call it is um, you have people that come in for half days and you
Mhm.
get to see them throughout the day. They do psych groups, counseling, medication management, and then they go about their days thereafter.
Yeah.
So,
Yeah.
and I loved that. That's,
Yeah. Yeah.
yeah,
And it's so interesting that aspect of your personality is very social. So then what you were drawn to in that profession or, the specific kind of category or like niche of that profession was really, something that allowed you to really engage with the people.
yes,
And I
yeah,
think it's really interesting to me because, sometimes I think, and I don't know that this is limited to the medical field per se, but I'm hyper aware about it in the medical field for whatever reason, in that sometimes there can be this way that people approach it or practitioners can approach it. Not everyone, I'm not even going to give a blanket statement, but it's interesting this idea of people in the industry approaching the clients as just a number, as
yeah,
just a patient, da 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 da. And I think given just the load that they have, and given just everything that the job requires, sometimes it can feel that way. And I know that people on the receiving end, that the patients sometimes feel that way, and that sometimes is the reason why someone can move from one practitioner to another because they feel like maybe one looked at them as more of a number or their condition versus like seeing them as a person. So it's really beautiful that you really like you're wanting to get into this specific area because you wanted to have that connection.
yeah. And it was much more difficult to have it within just the medical setting because you don't have the time. I mean, you're not really given the time or resources to have a full conversation with the patient and get out on time and have a family life.
Yeah.
It's a broken system, and it's just you have to get in, do what you have to do, and then you leave, which is sad because you have a lot of great people that want to be with the patients more and they're just not able. Yeah.
I think that's a really beautiful point that you bring up in that it's not necessarily the people that are, making that decision to not connect as much. It's the people having to navigate the system.
Right. Yeah. Yeah. I think that's what it is. Because I think most people go into the medical profession to help people, right? I mean, sure, some people do it for money, but I don't think any money in the world could be worth some of the stuff people have to go through. You know what I mean? There's other ways. There's other ways. But yeah, I really think it's system wide. It's an issue.
Hmm.
You know,
And it's an interesting thing to consider, this initiative of Heal the Healers, because one of the things that would support in the healing and the wellness of practitioners is a shifting of the system.
100%. Yes. Yeah.
I'm like, in my mind, I'm already thinking about, okay, I need people who are in charge of the systems to have these conversations with me because
Yes.
it's like there might be resources in place and all these things that are like, okay, we're ready and available to support you. But then if the system that we've created is just a hindrance to you getting that support, then the system has to be shifted.
Yeah.
Hmm. That's really interesting. Okay, we might have to come back to that, and I'm going to be curious to see what Nancy, if she's able to
That's
join us, can
Yes.
can
Nancy
speak
would
to
know
that.
more about that for sure.
So I was
Yeah,
like, my
Nancy.
wheels are spinning. My wheels are spinning. Um, so I'm curious about your experience, and I don't know if it's just if you want to like walk us through a day in the life of you,
Okay.
in general. I want to hear kind of what that looks like an average day. Which, and I know your days can look like this, depending on just the clients that you're supporting and them navigating their wellness, what's going on in the actual facilities where you work and so forth. So I'm curious to hear like what you navigate on a daily basis. In general, and then shifting gears into how that may have shifted in light of the pandemic.
Sure. So let me first give a brief overview of kind of what the consult liaison area is kind of in charge of, I guess, or their role. Um, so we go in, we're normally the primary team, such as like the medical or surgical team, will put in a consult for psychiatry or behavioral health. And then what we do is we get the consult, we get a whole bunch in the morning or throughout the day of different patients within the hospital, specifically the medical floors. And then we take those patients, we divvy them up the best we can, and then we go and see them individually. The consults can take anywhere between an hour and a half is the fastest to 4 hours sometimes, because we
Mm,
have to go through all the medical background, and then we have to do a full psychiatric interview, which is normally 45 minutes to an hour, and then we have to see what medications they're on, get a diagnosis, and then figure out a treatment plan. So it's pretty extensive in that way, and it's very time consuming. um, and in the beginning of the pandemic, we were short, people were out quite often, and we had to pick up a lot of different patients. Um, and most of us were working extremely long days, and it was exhausting. And we go in and we listen to people at their lowest points, and um, try to help them. But all that energy, you take that into yourself, and there's really nowhere you can put it or you know discharge it, if you will. Um, because it was so busy. We were getting home really late, and just to even consider going to counseling or anything like that, yoga, it was kind of off the table. So during the pandemic, things kind of just went downhill.
mm,
I think right now, maybe they're getting a little bit better. Staffing is improving. But overall, I think the mental health of the actual practitioners and providers uh, is still needing some improvement. Does that make sense? Okay.
mm. Yeah. I mean, what I see is that before the pandemic, people needed support.
Sure.
Like people need support in general. We're
Yeah.
humans having this experience, and we have all the different things that we are working through, the traumas, the pains that we ourselves individually have. And we have our families, we have our ancestors and all the things. So there is the potentiality for people to just need to do work in whatever ways are necessary. So you have that as like the starting point. So
Yeah.
now you are practitioners, you have that, and hopefully you are practice enough and have done enough self-care and work on yourself to then go into situations where you're having to navigate people's things. And and I don't, and maybe you can speak a little bit to this, because I know for the type of work that I do in spirituality, esoteric work, a lot of self-awareness, a lot of looking at our like emotions and our thoughts and patterns and all the things. Like that's work that I've been doing for a long time, but it's not something that necessarily like was a thing in like high school or elementary school and then college. Like these are
Sure.
things that over time, as I've been an adult and continue to adult, I've kind of pieced together myself in different ways. And because I'm so practiced in it and I have the specific affinities, I have to do energetic work and spiritual work, because I do this work on myself and I'm able to hold space for people. And I don't know if this is shifting or not, but I'm curious, like, what kind of things are you taught as someone in this field?
Yeah. And okay, so you have all the book work, right? Yeah, I mean, when you go through school, you get all the book work, the jargon, the concepts. I mean, I guess it's not jargon, but when you're going through school, it is, right? Nobody has the time to do any of the stuff you're given because you're too busy focusing on school. Um, and you know what you're supposed to do, but it's actually putting it into practice, I think, is the hard part. And
Hmm.
especially if you've never really, I feel like it comes different if you go to someone and they teach you rather than you being like, I know this information and it's frustrating because I know it. So I don't want to go to someone to get help because deep down I know what I'm supposed to be doing, but I can't do it. And sometimes I think the encouragement piece and the accountability piece is more important than like just the knowledge. Do you know what I mean? Like putting it into practice. Am I making sense? Did I say that?
Sure. It's like the information is one thing,
Yes.
like the scholastic information and like that strict, rigid, the container is one thing, but then the actual like you said, the practice,
Yes.
the experience of it all.
Yeah.
It's like there's only so much you can understand by keeping information here. You literally have to embody and understand and move with that because that's the only way you will ground that knowledge in a deeper way than just right here.
Yeah. And I think sometimes there's some embarrassment to know that, for example, I'm a psychiatric nurse practitioner. I don't want to have to go for counseling because I'm like, I know that. I should know that, but I don't. You know what I mean? Like I do, but I don't. Like yours. And it's frustrating because it's like that's embarrassing to tell somebody, yeah, this is my profession, but I'm not doing the things that I know I should do.
And also, you're working in a system
That
where
doesn't
there's
like,
not a carving out of time to be like, okay, everyone who does psychiatric work, let's make sure you have this amount of time to get the work that you need to get done to make sure you're good.
yeah,
Like, get the
yeah,
work you need so you can do that same work to other people who need it. So the
yeah.
system is, it's like there's all these systemic things from the time you're studying
Hmm.
through and into the time you're supposed to be practicing this vocation.
There really is. Yeah, yeah.
Let that sit, folks. Just marinate on that. Because to me, this is part of like what is needed to support individuals. And I'm
Hmm.
actually, Dr. Ekeke has entered the building. I think they left. Let me just double check to make sure nothing happened. Okay. Well, we'll see if they come back in. I just sent them a message. Okay. This idea of like the system is not just like the facility, like all the infrastructure and all the things. It's like even from like the training and education and like the emphasis that is placed on things.
Hmm.
It's like, and I remember that, so I was pre-med for a part of my undergrad. And then I was like, I don't want to do this. But even just the experience of college, the idea and the normalcy around like you just have so much schoolwork, you have
Hmm.
so much work, you have to study so much, like when do you have time to do things? And then I was always so surprised about the people who, on top of having, they're following this specific degree or even like a dual degree or whatever, double majoring, double. I'm like, and then on top of that, they have the jobs. And then on top of that, they do the sports and things. I'm like, how y'all?
Yeah,
Man,
I know.
I don't understand this, but it's like something that it just always seemed odd to me that how are you ever going to instill this information if you're constantly having to like take in the information and like test and do
Yeah,
all these things? So even that systemically is to me can be problematic.
yeah. There's no rest and digest, you know? You just need to take the information in. And I feel like I mean, that's part of it. You really need to be able to digest information in order to make it make sense to you or to apply it.
On that note, I'm going to bring in Dr. Ekeke.
Okay.
Let's see, just connecting.
Connecting.
Yeah. It, to me, just the idea of just, it's a lot.
It's so much.
It's like the information is a lot.
Yeah.
The schooling is a lot.
Mm-hmm.
You get into, the actual, well, and then the testing to get the, certifications on things, that's a lot.
Yeah.
And you have to apply for a job, and you have school loans, and that's a lot.
School loans.
And then you get in the job, and then you're working with the clients, that's a lot. You're working in with the company or the facility, that's a lot. So it's like a lot on top of a lot on top of a lot on top of a lot.
Yeah. And a lot of times when you get to the place where you thought you wanted to be, you can't leave it even if you want to because of the student loans.
On that note, hi, Doctor.
I was like, she's going to exit.
Hello, Dr. Ekeke. Good to see you.
Evening.
How are you feeling right now? How are you? Because you just left work, or you're still at work.
I'm in the office, but I finished. You caught me at a good time. That's why I said 5:30, because I finished everything, and I have until 6, maybe just 6 to chat. So, this is the job. You have the little slices of time. So
we're
anyway, but
what we're talking about.
Welcome. Thank you. Hi, Sarah.
Hi.
So I'm going to introduce you. I'm going to give you a little spiel about you, and then you can introduce yourself, and then I'll just kind of jump right into just kind of asking you what a day in the life of you looks like, given this work that you do. So, so Dr. Nancy Ekeke is an internal medicine physician. She completed her undergraduate studies at Stanford University, earning a degree in history of science and technology. She went on to graduate from the Boston University School of Public Health, focusing on international health and maternal and child welfare. After her studies there, Nancy worked at La Canada High School as the health educator for 1 year, and then went on to attend Chicago Medical School. She later trained in Milwaukee and Oakland, California for her residency programs, and completed her training in allergy and immunology at UC Davis. Currently, Nancy works at Kaiser South Sacramento. She also gives volunteer lectures on public health and primary care. Thank you so much, Nancy, for all you are, what you do, what you have to deal with, because I've heard stories. So yes. And Nancy's family. She's actually my family. So
full disclosure, we're cousins, first cousins.
I've heard the things, just bits and pieces of things, like scratching the air above the surface of the things that she deals with, on top of doing the actual work, which is like, can I just do the work? Why do I got to go through all this other stuff just to do the work? Like, just think about that. You've already heard a little bit of what Sarah and I were talking about. It's like, here's the work that we actually are like, and this is what I want to do. But then there's,
I think the big thing to answer that question, because that's a good question, is, and I know this has been said a lot, it's about lack of faith in institutions, but I think that comes from lack of access. When you don't have something that you are supposed to, you are told that you need because of cost, because of location, or you see it taken away. Like there were a lot of closures of hospitals and clinics during this time that was already happening, but especially in areas that already lacked adequate access. They've lost a lot of their providers or their infrastructure. And when you have that happen again and again in the same communities, it builds this disillusionment. It lowers expectations. People don't think that when you have, for example, government mandates about certain things, that it's going to benefit them, or they're even going to get the resources to be able to plan anything. That's why you saw the way the pandemic was received in different parts of the country was so uneven. Even in cities that had money, there were certain pockets of communities that didn't either access what was available or didn't get the resources. Either it was an access issue where they didn't seek it out even when it was available, or it wasn't given to them. It was a lot of mismatch. And we have a very patchwork, threadbare system where it's the, sort of the individualist kind of free market ideology is applied in many ways to healthcare, and healthcare doesn't work well with that because a lot of good health comes from prevention. But because we don't have a lot of that, because of the way we interact with our system, we have a lot of intervention, which is often late and often becomes expensive. You often lose people to follow up because of all of the reasons why they never got care in the first place. And you also have a lack of continuity of the provider because people retire, people move, or people decide to change their career path. There are plenty of doctors now who are leaving the profession because they're just burned out. COVID's burned out a lot of people. Or they've become so sick from getting ill with COVID that they just can no longer practice in the way that they used to. And it's a mixed bag. And because we haven't been cohesive in our approach, and in particular, physicians have been sadly inclined to be autonomous in their approach to the job and not collective. They don't always have the sympathy for their colleagues that I think they could. People who are struggling, people who are human beings who have needs like anybody else. And it just kind of adds to the idea that, well, I'm fine, this person should be fine, which may not even be true. And it sort of adds to the dehumanization of and the lack of personhood that you apply to your colleagues, like everybody else. And I worry about more people going into the profession if we don't change that. I think it's going to be very hard for people who are not the children of doctors, for example, to want to go into the profession. In particular, primary care, if we don't make it better, if we don't recognize the shortcomings, because it's part of a much larger conversation that I think for a number of conflicting reasons, people may not want to have. Your uncle is a physician, and I've had some conversations that are somewhat difficult where I'm like, your generation of doctors did not set things up very well. You've set us on a path that's very hard to course correct. And they're still in leadership positions that make it very hard to course correct and not feel that there's a risk of harm if you speak up or try to change things. And it's hard because public health requires speaking up and being involved and being engaged. But that can be very difficult to do with all of the noise that's going on and the worry about your professional safety and security and just your physical safety because of what's going on right now. And it's not just with physicians, it's with other healthcare providers. I see it, people are under stress, they're worried. And we do need to don't just talk about it, but have things in place to deal with it. I think when you talk about it and you don't do anything, again, that's where the cynicism sets in and the mistrust and the disillusionment because you're not fulfilling promises. So for me, I would prefer to say something as much as when I can do something and not overpromise and underdeliver. I think that's a really big key point, to do more than you say so that people will not be disappointed and they will not mistrust you. Because really your word is your bond. It's an old saying, but it's true.
And I think it's interesting how, you entered into the conversation talking about a lot of the structural issues that affect patients. Like before they even get to come see you, it's like, how much does it cost? Can they get it? What was the service like in this community? And all these different things that can create a lack of trust. Sarah and I were talking about, all the different things that you have to navigate that prevent you from really connecting with the clients when they're there, because you have all this bureaucracy and all these different things and all the systemic things. A lot of clients or the patients or the general public may not necessarily be, again, if they're politically savvy and follow all the different things, they might know that, okay, this mandate came out or this law and that law and insurance and so forth. So they might have an understanding. But for most people, or when they're in situations where they're under duress, they're not thinking about the system. They're like, doctors, the physicians, the practitioners aren't helping us. So it's like, you're getting the brunt of their frustration. You're also having to deal with the system. So now you're not just like a practitioner of this specific, service, you're like middleman, you're a negotiator, you're all, and you're trying to handle and juggle all these different things. When it's like, can I just do the actual work of caring for my client in this specific way?
And I think that's where I talk about the challenges that they need to address, because they don't train you for that. When you're in training, you have a lot of people in place who deal with that, and you just do the work, and you're trained to do the work. You're not trained about the context of the work that you do in many cases. I don't know if that's the same everywhere anymore. That might be changing. I hope so. But context and, perspective about advocacy and communication, I learned that in grad school. You really didn't have that when I was in med school, even in residency. And I think that's where we need to work on it, is how to improve our understanding of people's situations and how to understand how better to work independently in real time, not just task oriented, but you have to deal with insurance. You have to deal with, outside referrals, outside, providers, outside, how to navigate that so that you don't feel overwhelmed, because that's one of the biggest critiques now, is the amount of time spent with non-clinical responsibilities and paperwork. And that is the time that you don't have to deal with patient care. But if you don't do that, you don't get paid. And you may not just be the only one. You may employ people. You may have people under your service. You may pay rent to an office building. You may pay property tax. So a physician may not just be a doctor. They may be an employer, as well as a tenant in a building, as well as a parent and a spouse, or adult child who's taking care of their parents. They're a human being within the world. So those responsibilities do not negate what they do. It applies to them too. And I think sometimes people forget that when they say, oh, doctors make too much, or talk about their salary. I'm like, well, let's talk about lawyers' salaries. Let's talk about investment bankers' salaries. And, how much school did they get? And it's not to diminish their training, but it's like, we go to school for so long. People who are in healthcare, so many of them go to school for so long. The debt burden is so high. Just to make ends meet in a city like Los Angeles, for example, in New York, you have to have a certain amount of income. So I do find that at certain points being vulgar, because I think that's a distraction from the fact that the bill for the services that you get is not about the doctor's fees. They're an easy target, but they are not the target. The bill is really for everything else that you're getting. All the other input and bureaucracy, that's really what it is. It's not about the provider. That's usually one of the last things that gets looked at. But it's the first thing that gets criticized, because it's an easy mark and it's very obvious. That's where the transparency is. You don't have a lot of transparency with the other stuff. So if people really looked at what the cost was, the provider fee is a small portion of everything else they get billed for.
Yeah.
And that's important, but people don't know that, they don't get that information. They don't understand their insurance bill. There's so much that's quite complex that the average person wouldn't know with healthcare. So even though it's frustrating, you have to sympathize that people aren't learning that, in their daily lives, and they're not getting that support to understand that. So I don't know.
Yeah.
But
yeah. The common thread that I'm hearing between, what you're saying and what Sarah had discussed and, brought into the room, the common thing for me is like a lack of compassion that stems from a lack of understanding. And, what we had talked about was, sometimes people imagine, the patients imagine like, I'm just a patient number X, or I'm just my diagnosis. You're not, getting to know me on a personal level. And it's like, here you have, you, Nancy, who you're like, I'm trying to advocate so that I can help you get the care that you need, but I have to deal with all these things. You have someone like Sarah who got into this field for the purpose of actually working directly with the clients and just that connection. Like that's what drew her. But there's all these things. But again, if the public doesn't know that, then there's like a lack of compassion. There's not understanding. So then there's a demonization, right? And then on the flip side, because I'm always about, let's look at everyone has a part in this. Everyone has a part. Can't just be all one person, taking all the responsibility. The practitioners, having compassion for the fact that the general public doesn't understand a lot of these systemic things. They don't understand. And if they don't understand, of course, they're going to be upset or they're going to have mistrust and all these different things. And so, having that compassion on that side and all the other things and reasons compassion is needed, having compassion on this side, compassion for each other, then that can create conversations and even I think start to chip away at a lot of these systemic things because now you're allies. It's like doctors and physicians, practitioners, all the people are like, hey, we're trying to help you out. And then if it's them like, hey, let's help you out so you can help us out, then you have more numbers of people that can be like, system has to change.
Yeah.
The system has to change. And let's work together because that's the only way that we can ensure that everyone gets healed.
But I think that also takes public buy-in because historically, whenever you've looked at healthcare, because of the inertia to maintain the status quo, because there are people who benefit from the status quo, more than others. We all have some benefit, but there are some who disproportionately benefit. There's an inclination to not change. And so there's often a backlash, and it's with, propaganda. People will sometimes stick with the dysfunctional system because it's what they know versus something else that's what they don't know, particularly if they perceive that it's a giveaway, to other people, who's deserving. There's that very puritanical, idea that who's deserving in the judgment, and all of that used to be attached and still is in some ways with healthcare. And you saw that a lot with people during the AIDS crisis when it first came about, who deserved to be sick and get, all of that nonsense, which is terrible, but it's true. I mean, you read about what happened back then and it's kind of breathtaking that people would make these statements publicly, but they did. And I think that's what going to also be looked at with COVID. We're going to have a reckoning about how we looked at each other and treated each other. And, you have to meet the moment because, there's some stuff that you can't explain away. There's some people that it was really character revealing what this pandemic has shown and how we deal with it and deal with each other. It says a lot, and I think it's uncomfortable to see some of the less pleasant things that have been exposed about our society by that. But those are things that probably needed to be dealt with honestly and acknowledge why these things are occurring, particularly with our society more than other Western societies with COVID.
Yeah. I'm curious about, and I want to start with you, Sarah, if you have a perspective on this, because you said something interesting, Nancy, about like public buy-in, and people are afraid to change and do something different than what they know. So they're going to stick with the same thing, even if it's broken or it's not serving everyone. And I'm curious from another perspective about that same thing, as far as on the practitioner side, when it comes to alternative methods for healing and wellness. And I say this because it's interesting, and I've gone through my own evolution and understanding of things. And for me, to me, it's health and wellness is a spectrum. From the least invasive to the most invasive, from the energetic to the mental to the emotional to the physical to the chemical. And to me, it all works. It's all necessary. It just depends on timing, the individual's own perspectives, all the things that are in place. And I find that across the board, everyone, like there's some people that are like, no, natural, holistic is the only way. Some people are like, no, surgery, medicine, chemicals, the only way. I'm like, how about there's a spectrum and things can be integrated, and something that was treated medically in this way, maybe there would have been some interesting successes with like energetic or spiritual work and whatnot. So I'm curious too about, that idea of like any attachment from any practitioner side of like things that are considered like conventional medicine that don't take into consideration other forms of like wellness that could be supported and integrated. And I'm thinking, the reason I asked you, Sarah, is like, I know we've had conversations in the past when you were talking about the things that you were experiencing, just, going to work and all the stresses and things. And I was like, put this crystal here, pray, or like do those things to help you with your own self-care. There's, again, not just for the client, but for you, even as a practitioner, of like, how we integrate all these things to like give us the full benefit of whatever can help us.
Yeah. And I think people are really one way or the other, they tend to be, right? Like it's either this or that, natural, holistic, or it's pure medicine. And I think a lot of times people will wait till they really need treatment. Like Nancy was saying, it's like too late, going to be super expensive, but you could have been doing more naturalistic type things and staying healthy. But I do think there's a middle ground, right? I know I took oils into the office, and one of my peers, he was really offended because he's like, those are such crap, and like he made fun of them, right? Any kind of crystal stuff, anything like that, they're very much like, they look down on it. And yeah, it just depends who you work with. But I do think that's something that there needs to be more education on, that they can coincide and work together,
Yeah, and not replace, because obviously, again, I
not
think
replace. No, because you need, I mean,
the extreme is like, and we're going to use this as a replacement for this. It's like, hold on,
yeah, no,
be careful, because I know
year
there's
old.
regulation that doesn't necessarily happen in, a lot of the holistic field. So that's something I've had conversations with people about. And that lends itself to, on the one side, this idea of freedom, I can do whatever I want. I'm like, but on the other side, it lends itself to this, to danger and people having to regulate themselves. And if you have integrity, then cool. But it's like, if you're not within a system that supports everyone, then that can look a hot mess sometimes. So again, just that integration, that respect for all of the things, and say, okay, at the end of the day, how do we best serve the public to provide wellness services that can look like the spectrum, and what do we need to put in place to support both the practitioners of the wellness practices, whatever they may be, and the recipients of the wellness practice, so that we have a holistic, well-oiled, functioning system that serves everybody.
Yeah, and I think one of the big drawbacks is insurance isn't going to pay for a lot of the holistic stuff, right? The medical things, primarily medical, insurance is more likely to pay. So
even the medical, it's like they'll pay for surgery more than they'll pay for physical therapy.
right.
It's just really, it's sort of odd. And we do have acupuncture like at my clinic, which is good, and we have mind body medicine for patients with stress. You have a lot of people obviously who are anxious and depressed right now. So we have a lot of mind body classes and wellness, anxiety management, things like that, visualization, which is actually, I think, really nice. I do try to get my patients on that path before we consider medicine. And I have patients who openly say they'd rather not be on medicine, which is great. That's fine if that is because it's not going to work if it doesn't make you comfortable. It's not going to work if you don't buy in and believe that this is a therapeutic benefit, because part of it is placebo, no matter how effective it is. The placebo effect is real. You respond better to treatment if you believe in the treatment that you're getting. It's just that simple. So I'm fine with people trying different things, but I always say proceed with caution. And, when they tell me it's natural, I say, so is poison ivy, so you can't just go and douse everything, and I've seen people who wound up in the hospital with things, either do it yourself or people who, tried something medical that was not advised electively and wound up in the hospital. So it goes both ways. If you're doing something that's reckless and not advised, you may have an adverse outcome. So I think it's careful that we don't make it so that one side is better than the other, like what you're saying, and make it so that there's a room to have a discussion about different treatments, especially if one hasn't worked for you, that you can try something else. That's my thing. That's all.
Definitely. No, I wholeheartedly agree. And it's interesting as you're talking about the placebo effect.
Felicia, I just want to say, I hate to break up the discussion. This has been really nice. It's almost 6 and I have to jet. Thank you for inviting me. I really appreciate that. I love you. I know everybody's like, oh my gosh, it's just so sappy. But Sarah, it's really nice to see you again. I don't know what kind of light you're using. You look incandescent on your Zoom.
It's a glow of yellow lights in my bedroom because I don't have anywhere else to sit.
I was like, she looks really radiant.
Oh, it's definitely the lighting. 100%.
Your spirit. You have a radiant spirit.
Yeah, but anyway, and Felicia, I like your background. Your Zoom background is good. But anyway, I'm gonna go. I will talk to you ladies, hopefully offline. Okay, and wish you all the best. Okay, let me know if there are any future meetings. I would love to join. Okay.
That's wonderful. Thank you so much, Nancy.
Take care. Bye. Bye. Bye.
Oh, so sweet. Love her. She's brilliant. Brilliant. And I want to be respectful of your time too, Sarah. And I mean, thank you so much for just everything that you've brought in, the perspectives that you have shared. these conversations, I feel like they can be like hours and hours and hours. And it's,
Yeah.
because we're talking about a multifaceted, multi-pronged situations, circumstances, fields, energies, all these different things. So I think there's so much that we can talk about around it. And, I want to, as we wrap up, really kind of go back to the recognition of what it is that you need as someone in your profession, what it is that you see your colleagues in general. Obviously, everyone's going to have their own unique circumstances given, again, like you said, their family life, what they have to deal with outside of the office. But, things kind of merge, and like you're dealing with all the things all the time. But I'm curious from your perspective, what things you wish were in place to support you individually, what things you wish were available to support people in the psychiatric nursing, field. It could be specifically even the nurses versus the psychiatrists who, have not the nursing titles. What are those things that you wish you had access to support your own wellness and healing, even if it's just a specific understanding by the public?
Yeah, I think one of the big things is just awareness from the public. For example, I remember at the start of the pandemic, I know my daughter used to play with a couple of kids, and um, they didn't want her over for a little bit because I was in the medical field and I was in the hospital exposed to COVID. But then again, they would be going to the grocery store and having just as much exposure um, as I would. So that was kind of hurtful because I was like, I'm working really long hours, and then to have my child not able to play with somebody else because of that misperception, if you will, that was hurtful.
I
And then
remember, we talked, I don't know if we talked soon after that happened.
I think
Something, we were
so.
having a conversation, we were talking about the pandemic, and you just broke down.
Yeah, it was really hard because it was during the time I was working a lot, and um I guess I was just kind of keeping everything in, and I didn't realize how much it was. And I'd be coming home from work super late, going to work, when it was dark, and coming home when it was dark. And I'd see people just hanging out outside the homes, and um, they didn't really want healthcare workers around. I know in Detroit, some healthcare workers were shot at, and one of my friends worked over there, and she was telling me about it. And it was just super overwhelming because I already didn't want to go to the hospital. Nobody wants to go to the hospital when there's a pandemic. You don't want to risk getting your kids sick, or you getting sick, or anyone else.
Hmm.
But you kind of had to do it. And then that kind of like, the stigma that was on you because you worked in healthcare was really hard. Um,
I'm
yeah,
I'm
it,
like angry right now.
it was hard. Like, even when I think about it, I'm like, oh, it was just really
No,
hard.
the anger that is rising up is like, wow, like here we are risking our lives to support the collectives and potentially you if you need to come in. Because,
Yeah.
like, I'm not gonna be like, no, no, neighbor, because here you are. Like, and rather than being given, like, rather than people just like bowing at your feet and like throwing rose petals and all these things at you, they ostracize and they shun you.
We got an email that we weren't allowed to wear scrubs into the grocery store because there were complaints. And there's like dental technicians and all sorts of people wear scrubs, right? It's not just people within the hospital. Vets wear scrubs. But it was that bad where it was a system wide, like, no, you cannot wear scrubs into the grocery store because there's too many complaints. It's just so inconsistent. I mean, I don't it, mm,
Yeah.
mm.
It's I mean, I know what it is, so like the anger's there, and I also am like,
Yeah.
okay, people's fear and their ignorance. Also,
Yeah.
there was a lot we didn't know about the pandemic and COVID and all the time. There's just we just don't know much. We think we do
Yeah.
know something and then it changes. So I have compassion for the ignorance, but the anger for me of just like, wow, the lack of regard for you as human beings that are doing this.
That's what it yes. Yeah, like, still people, you know? And I didn't realize how much the effect all the COVID all the crisis had with it. But one day, my friend from Bolivia, he asked me if he could call and have his friend online with me so he could practice English with me. So I let him, and then his friend said, "How are you dealing with all the sadness in the hospital and the hurt?" And I was like, nobody has asked me that for 1.5 years, since the pandemic. And I was just like, like I got so emotional, but I was like, okay, bring it in. This isn't about asking. I mean, it was just like so overwhelming because I thought, my gosh, is this how people feel when I ask them how they're doing in the hospital? Because maybe nobody has asked that, because you don't really think to reach out when you haven't, when everybody's going through the same thing, right?
Yeah.
But yeah, it was just kind of an eye opener, like, oh, this is really bothering me,
But the idea is you got to keep it together, hold it together, because you got to service the clients, and only they're allowed to be feeling the things or break down. But no, you got to hold it together.
Yeah. Yeah.
And then whether or not people do then leave those spaces and then break down or have their release,
Right.
that's the question.
But then how do you have that release when you have a family at home? And then it's a lot.
Yeah.
So I think you should have mandatory mental health days at work. Don't you think that would be good?
Wouldn't that be just, mental health days at a mental health psychiatric facility?
Wouldn't that be, it would make sense.
That, right? It just is like, why would you not?
Right? That's why has this not happened? Why? Mandatory, not just like, oh, you could have a mental health day, because then they'd be refusing them all the time, right? No, right. People are on vacation, refuse. People are sick, refuse. No, mandatory.
Like, it is for the well-being of you and the clients that you take this time.
Yeah.
I'm for it.
I know.
You don't know what to do with yourself? That's not our problem. You work that out. That's part of your...
Get Nancy back on. Have her fix the system.
Exactly. Go do something else, somewhere else. Go help your fellow practitioners in other places. I agree. It's, I was speaking to, and I'm looking forward to having a conversation with caregivers, like whether it's people in professional settings and homes that are giving care to, hospice or, whatever the facility is, or people that are caregiving someone who is residing in their house, like a family member or so forth, who's aging or who's ailing. And, one of the things we talked about, and I'm so excited to like delve deeper into this, of like her having a caregiver for herself.
Yes.
The work you do, because you do that work, then you need it for yourself almost even more. So you can then do it for the collective.
Yes. It's true.
Okay, we're gonna work on this. We're
gonna figure something out here.
I'm like, hey, see me show up at different
facilities. Problem by next week.
I need you to no. They're like, who are you? I'm like, I'm ONYI. Heal the healers.
Fixing it.
The last question that I have for you is, and as I had approached you to, be on this call with me to discuss this initiative, Heal the Healers. So when you hear the phrase heal the healers and you just let that marinate, where does that land for you? Like, what comes to mind, whether again for you personally or just expanded for the collective? What comes up?
I think it's such an important concept. Because I feel like people feel so drained in society right now anyway. And then the people that are doing the healing work, they don't normally have the time or energy or resources to have somebody helping them. Right. So I feel sad, frustration, and then even gratitude that you're bringing this up, because I think it's such an important topic. And it's just kind of like, where do you go with that? Like, what are the steps to take so that people do have the resources to stay healthy, to stay well, so they're not ending up, with all these medical issues from high stress and whatnot, and then Dr. Ekeke is in the hospital taking care of them. Just the more of the preventative health. I think that's so important, but I don't know. There's not enough resources for preventative health or the finances, the funding for it, I should say.
Well, I pray for, work for, look forward to a version of this earth where that is absolutely there and established, to where you can go into your offices, you can start your day doing this work feeling refreshed, feeling revived, knowing that you're held and supported, and that the only work you need to do is the actual work that you signed up to do.
Yeah, that would be beautiful.
We're gonna work on that. We're gonna work on shifting closer to that. Let's see what we can do. Oh, thank you so much, Sarah.
No, thank you.
You're welcome. Such a pleasure to see you, see your face, your radiant, luminescent face.
The lighting, totally the lighting.
The lighting can only enhance what is already there. So it's great to see you. Thank you so much for the conversation. Thank you so much for your perspective. And I'll have all the information in the description for Sarah, and also a cause that she is excited to, share and have people support on her behalf. So definitely share this, everyone. Share this, have conversations with people who you know in your life that are doing similar work. Start asking the questions. How are you feeling in light of all the things that you navigate in your workplace? Even just that simple question shows a level of seeing them and remembering their humanity.
So true. Yeah.
We're all in this together. We're all human together, and we all get to heal together, and you get to heal so you can help others heal. So love you, love you, love you.
Love you. Thank you.
Welcome. Thank you. And thank you, everyone, for joining us. Have a wonderful, beautiful rest of your day.